Maintaining good kidney health is crucial for your overall health, and managing waste products like creatinine and urea plays a key role in this. Higher levels of these wastes in your blood can indicate impaired kidney function or potential kidney issues, which may lead to symptoms such as fatigue, swelling, and high blood pressure. Long-term high levels of these products can increase the risk of severe kidney issues and other health complications. This is why it's important for you to lower creatinine and urea. Fortunately, making some dietary and lifestyle changes can help you lower them naturally. In this video, we will explore 10 practical and effective strategies that can help you lower creatinine and urea naturally. By adding these simple yet impactful practices into your daily routine, you can improve your kidney health, maintain your overall health, and enjoy a healthier, more balanced lifestyle. Keep watching. Before starting with natural ways, let's first understand what creatinine and urea are and how they can impact your health. This will help you understand the video in a better way. Creatinine is a waste product produced during the usual wear and tear of muscle tissue. After its production, creatinine is released into the bloodstream and transported to your kidneys to be filtered out of the body. Normally, the kidneys filter creatinine out of the blood and excrete it into the urine. However, sometimes due to their impaired function or kidney disease, your kidneys may struggle to filter this creatinine out of your blood and its levels may rise. Therefore, the amount of creatinine in the blood indicates how well your kidneys are functioning. Doctors use creatinine level tests to check kidney health and function. The average creatinine ranges are 0.7 to 1.2 milligrams per deciliter for males and 0.5 to 1.0 milligrams per deciliter for females. More than these can be concerning for you. Another waste product is urea, which is formed in the liver when it breaks down ammonia, which is produced when our body gets rid of extra protein. Then it travels to the kidneys through the bloodstream for filtration. Similar to creatinine, its high levels often indicate kidney damage. Blood urea nitrogen, BUN, is the term used to indicate urea levels in the blood. The concentration of urea depends on protein intake, the body's ability to break down protein, and the ability of the kidneys to remove it. Besides a degraded kidney function, high levels of urea can also happen due to dehydration or a high-protein diet, while too low levels might be associated with liver disease or malnutrition. However, BUN levels are commonly used to assess kidney function. The normal BUN level is between about 7 and 20 milligrams per deciliter. Having BUN levels outside this limit is a point of concern. Now, let's discuss natural ways to lower the creatinine and urea. Number 1. Eat more fiber. Fiber improves digestion and assists your body in eliminating waste, such as creatinine and urea, through your stool. This helps reduce the reabsorption of waste products into your blood, which can be especially helpful if your kidneys are not functioning optimally. Both soluble and insoluble fiber play a role in this process. Soluble fiber forms a gel-like substance in your gut that traps waste products, preventing them from being absorbed back into your bloodstream. Insoluble fiber adds bulk to your stool, which helps it move more efficiently through your digestive tract, minimizing the chances of waste entering your blood. This way, fiber can help you lower creatinine and urea by eliminating them from your body. So increase your fiber intake. Its recommended daily intake for adults is around 30 grams for men and 25 grams for women. Children need between 18 to 28 grams per day, depending on their age. To increase your fiber intake, add more fiber-rich foods to your diet, such as apples, pears, cabbage, cucumber, blueberries, corn, and oat flour. But remember that the fiber-rich foods you add to your diet should be low in potassium, phosphorus, and oxalates, as high levels of these minerals can strain your kidneys. Moreover, avoid refined or processed foods like canned fruits and vegetables, juices without pulp, white bread, pasta, and non-whole grain cereals, as these are lower in fiber. Number 2. Eat less protein. The body breaks down dietary protein into amino acids for various needs. However, the breakdown of protein also produces waste products like urea and creatinine. High protein intake can increase the production of these waste products, which can become concerning if your kidneys are not functioning optimally. As we have mentioned earlier, healthy kidneys efficiently filter out urea and creatinine from the blood. Yet, their levels can rise as kidney function declines. So, to reduce these levels, reducing your protein can help. This step can lower the production of these waste products and the burden on your kidneys. So, avoid high-protein foods like red meat, dairy products, and eggs. However, remember that several body processes depend on proteins. Limit your protein consumption under the direction of a certified dietitian or healthcare provider. They can help you control urea and creatinine levels while nevertheless meeting your dietary needs. Number 3. Take Chitosan supplements. Chitosan is a sugar from the outer shell of shellfish like crab, lobster, and shrimp. Taking its supplements might help manage your creatinine levels. Chitosan supplements are often used for weight loss and cholesterol control. Recently, some studies have suggested that Chitosan may also help in lowering creatinine levels, especially in individuals with renal failure, a condition where the kidneys struggle to filter waste effectively. For instance, a 2011 study investigated the effects of Chitosan on 80 patients with renal failure. In the study, half of the participants took 30 Chitosan tablets 3 times a day. After 4 weeks, those taking Chitosan showed significant reductions in their creatinine levels compared to those in the control group who did not receive the supplement. Chitosan may work by binding to fats and other substances in the digestive tract, which may reduce the absorption of waste products into the bloodstream. This could potentially help lower creatinine levels, though more research is needed to fully understand its effectiveness and mechanisms. Before starting Chitosan supplements, consult with your doctor. They can guide you on whether Chitosan is suitable for you, how much to take, and whether it can interact with any other medications you might be taking. Number 4. Stay hydrated. Drinking enough water is crucial for healthy kidneys. When you're hydrated, your body can efficiently remove waste materials like urea and creatinine through urine. Dehydration, on the other hand, reduces blood volume and can make it harder for your kidneys to filter waste. This can cause a temporary spike in creatinine and urea levels in your blood. Scientific studies support the link between kidney function and hydration. In fact, research found that people with higher urine output, a sign of good hydration, had lower creatinine levels. This suggests that drinking enough water helps your kidneys filter and remove creatinine, keeping blood levels under control. The same is true for blood urea nitrogen levels. Chronic dehydration doesn't just affect creatinine and urea levels, it can also put extra strain on your kidneys, increasing the risk of kidney stones and long-term damage. The amount of water you need depends on factors like exercise and climate. As a general rule, aim for about 8 glasses, 2 liters, of water daily. Also, keep an eye on your urine color. Pale yellow is usually a sign of good hydration. Number 5. Avoid diuretics. Diuretics, or water pills, are medications that help eliminate excess sodium and water from the body. Typically, they're prescribed for conditions like high blood pressure, heart failure, kidney disorders, and swelling. By increasing urine production, diuretics reduce fluid buildup and lower blood pressure. However, diuretics can have negative effects. They can decrease blood volume and renal blood flow, leading to a lower glomerular filtration rate. This means the kidneys are less efficient at filtering waste products like creatinine and urea from the blood, causing their levels to rise. Diuretics can also disrupt electrolyte balances, further impacting kidney function and increasing creatinine and urea levels. So avoid diuretics unless advised by your healthcare professional. Number 6. Lower salt intake. Salt intake can affect your kidney function and, consequently, the levels of creatinine and urea in the blood. This is because high salt intake can lead to hypertension, high blood pressure, which increases the pressure on the kidneys. This can impair their function over time and reduce the glomerular filtration rate, GFR, leading to increased levels of creatinine and urea. Moreover, high salt intake causes the body to retain more water, which increases blood volume and pressure. This additional strain on the kidneys can further impair their ability to filter blood effectively. So, lowering salt intake can help you improve kidney function and maintain creatinine and urea levels. The recommended daily intake of salt is 1,500 to 2,300 milligrams per day, which is almost about 1 teaspoon. To reduce salt intake, read food labels to choose low-sodium options, cook meals at home using herbs and spices for flavor instead of salt, and limit processed foods and salty snacks. Additionally, rinse canned foods and request no added salt in restaurant meals to manage sodium intake. Number 7. Overusing NSAIDs. Over-the-counter painkillers, especially non-steroidal anti-inflammatory drugs, NSAIDs, can be harmful if taken too frequently or in amounts exceeding the recommended dosage, particularly if you have kidney disease. Using NSAIDs excessively can damage your kidneys and lead to increased blood urea and creatinine levels. This is because these drugs work by blocking enzymes that produce prostaglandins, chemicals associated with inflammation and pain. However, some prostaglandins also help regulate renal blood flow. When NSAIDs are overused, they can disrupt this regulation, resulting in reduced blood flow to the kidneys. Reduced blood flow means your kidneys receive less blood to filter out waste products, leading to a buildup of urea and creatinine in your bloodstream and subsequently higher levels of these substances. Not everyone experiences negative effects from NSAIDs, but the risk can vary based on factors such as age, pre-existing kidney conditions, the type of NSAIDs, and the dosage used. If you take NSAIDs regularly or are concerned about your kidney health, consult your doctor. They can recommend alternative painkillers or guide you on using NSAIDs safely while monitoring kidney function. Number 8. Limit creatinine supplement intake. Creatine is a natural substance produced by the liver and transported to muscles, where it acts as an important energy source. When used by the body for energy, creatine breaks down into creatinine, a harmless byproduct of metabolism. In addition to its natural presence, creatine is available as an oral supplement. Some athletes use these supplements to enhance their performance, believing they provide an energy boost. For example, weightlifters and sprinters often take creatine to improve short-term power and endurance. However, if you're trying to lower your creatinine levels to improve kidney function, you should avoid creatine supplements. While creatine supplementation has been widely studied, there is limited long-term research on its effects on individuals with kidney disease. This lack of information is important because excess creatinine can further strain already compromised kidneys, potentially leading to severe health issues. Consult your doctor before starting any creatine supplements, especially if you're unsure about your kidney health. Number 9. Limit intense exercises. Intense exercise can temporarily increase blood urea and creatinine levels. When you engage in strenuous activities, your muscles break down more, leading to higher production of creatinine. This increase is usually short-lived and harmless for healthy individuals, but it's important to monitor if you have existing kidney issues. During intense workouts, your body produces more creatinine, and your kidneys might struggle to filter it out quickly. This also causes a rise in serum urea levels, as the kidneys can't remove it fast enough. Aging can further reduce kidney efficiency, making these changes more pronounced. To manage these effects, allow your body time to rest and recover after intense exercise. Opt for moderate intensity activities such as swimming, brisk walking, or cycling, which are gentler on your kidneys. Moreover, if you have concerns about your kidney health, consult your doctor before making significant changes to your exercise routine. They can help you design a safe and effective workout plan that supports both your fitness goals and kidney health. Number 10. Limit smoking and alcohol intake. Smoking damages blood vessels and can reduce blood flow throughout your body, including kidneys. This reduced blood supply to the kidneys can lead to decreased kidney function, which can affect their filtration rate and increase creatinine levels. So, quitting smoking is essential for lowering creatinine levels. To quit smoking, use nicotine replacement therapies, seek support from a healthcare provider, or join a smoking cessation program. Moreover, reducing or eliminating smoking can also help lower urea levels and prevent dehydration. Moreover, alcohol consumption can affect your kidney function in several ways. While research has shown that moderate alcohol consumption may help decrease the risk of chronic kidney disease, excessive alcohol intake dehydrates the body, raises blood pressure, and can strain the kidneys. So, reducing alcohol consumption can help ease this strain, prevent muscle damage, and lower creatinine levels. Excessive drinking can also harm the liver, increasing urea levels and causing dehydration that raises bun levels. So, to lower creatinine and urea levels, you should avoid alcohol. To cut back on alcohol, set limits for yourself, seek support if needed, and avoid situations that encourage excessive drinking.